Friends, I am Dr. Sujit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Myself, Dr. Sujit Ghosh from channel Dr. Ghosh Presents. You know, I am doing for last more than 1 year videos on homeopathy. There are 4 different playlists. Homeopathic therapeutics in Bangla, homeopathic therapeutics in English, homeopathic remedy picture in Bangla, homeopathic remedy picture in English. Now actually what I want to say is that you will get about 12 to 1300 videos on this subject. Top 8 homeopathic remedies for intestinal tuberculosis. What is intestinal tuberculosis? Tubercular infection of intestine is called intestinal tuberculosis. This may be of 2 types, primary, secondary. When direct tubercular infection occurs in intestine by swallowing of the organisms, it is called primary. When infection comes from TB elsewhere in the system, that is, TB was there previously in some organ, from there it is coming to intestine, it is secondary. What are symptoms of intestinal tuberculosis? In case of primary intestinal tuberculosis, abdominal pain, fever, tender fixed palpable mass in ileocecal area. Ileocecal area means this on the right hand side of our groin area. Secondary internal tuberculosis, secondary intestinal tuberculosis, fever symptoms, diarrhea, vomiting, abdominal pain relieved by defecation or vomiting. These are the 2 pictures of abdominal tuberculosis. This is outer picture, this is inner picture. Why is intestinal TB gaining importance these days? Intestinal TB, once considered a rare disease, is now re-emerging with acquired immunodeficiency syndrome and with multi-drug resistance Mycobacterium tuberculosis. That is, there are diseases like multi-drug resistant MTB or immunodeficiency MTB. For that cases, this intestinal TB now gaining importance. It was not that these type of diseases were not there previously. How intestinal TB can be prevented? That is the most important thing. It is a fact that there is no certain way to completely prevent TB right at this point of time. But there are a number of ways that can be practiced to reduce spread of TB. PCG, Bacillus Comet Guerin vaccine is the only licensed vaccine against tuberculosis in 1921. It is used worldwide. Nevertheless, more than 9 million people are victimized annually. That is, more than 9 million people are getting infected with TB annually still now. This bears testimony to the limited usefulness of BCG. Till today, early detection and proper treatment of TB has been proved to be the sit anchor for prevention of TB. Following 3 norms are practiced widely. Number 1, TB organisms thrive in a place with limited ventilation. So, well ventilated places are a must for the patients, for everybody who want to avoid this particular disease. Well ventilated place, because TB cannot thrive in well ventilated place. Number 2, UV light kill bacteria of TB. UV light is a part of sunlight. So, where sunlight is abundant, TB thrives there less. Covering mouth and nose when coughing, sneezing is an effective way to stop spread of infection naturally. Finally, healthy immune system is the best form of defense against TB. If you got some healthy immune system, TB cannot infect you. What is latent TB? When TB bacteria are present in the body but not active, there are no sign symptoms and nor does it spread Mycobacterium tuberculosis in the environment. The person is affected with latent TB. There are crores of people, particularly in Bengal, because the Bengal area is more probability of TB infection is much more in Bengal area. Bengal, I mean West Bengal and Bangladesh, these areas. TB patients are huge number of TB patients, and the potentiality of TB patient is huge, and also there are so many latent TB patient, so many. You may think that I have no infection with TB, but if your lung is examined thoroughly, it can be seen there are so many infection, and that infection has been circumscribed by your immune system, so that is not spreading as a disease, but your lung bears the testimony to the infection. That is, you have already been infected. This type of patient, there are so many here. Maybe myself. This is the, on the right hand side, the picture. This is the microscopic picture of Mycobacterium tuberculosis. How can one enhance one's immunity? That's an important thing, because I have already told that immunity is important. Our immune system is very complex and influenced by a lot of factors. However, following 7 good practices are enough to enhance immunity if practiced sincerely. Eat and drink water properly. When eat properly, drink water properly. Do both things. The both eat and drink, both of these things must be proper. Be physically active. Maintain a healthy weight. Do not smoke. Shun all other addictions. Get enough sleep. Do something regularly that gives you pure joy. Do not allow unwanted strain to accumulate in your mind. For these two things I will say something, because last 2 points you will never get in any video all over the YouTube, because these are the 2 points that I have coined from my personal experience. I'm a most senior person. I have suffered a lot. I have seen lives a lot, patients a lot. So from this thing I've noted that pure joy means joy that will make you child, that you make feels like child. That is pure joy. If you can do this thing, then your immunity will certainly increase. Another thing, whenever you are tortured mentally, that is, you are being scolded or you are being charged with something which you have not done at all, that is unwanted insult, unwanted pressure on your mind. This type of thing you would not allow to enter in your mind. Whenever you will face something, there are 2 types of person. One person, they at once attack the person fiercely. Another person just bears this and bring it to home, and coming to home they become very much disturbed in mind, because they have carried this thing which is not unwanted. So whatever you do, you don't attack somebody. That is very bad thing, but you certainly vehemently protest, verbal protest, raise verbal protest against it. If you raise verbal protest against it, it will not penetrate your mind, it will not be settled in your mind. But if you come silently, it will bear in your mind, and that bearing in mind will give you strain, and that will accumulate in system, and that accumulation of strain will weaken you, will weaken your immune system. So be careful. Whenever you are charged with something which is not true, you raise voice, protest. Don't come silently back home. What are complications of intestinal tuberculosis? Fecal fistula, cold abscess, malabsorption, or blind loop syndrome. Blind loop syndrome is that is the patient is taking food, but the nutrition doesn't enter in the system. How is intestinal TB diagnosed? It is diagnosed through endoscopy. Now, what is endoscopy? I have just given a simple structure here. And first definition, endoscopy is a procedure to look inside an hollow organ with the help of an endoscope. This is the endoscope. This is endoscope. This thing is endoscope. Endoscope containing a tiny microscope lodged on the one end of supple tube introduced inside the body. There at the point of entrance, this point is there is a small microscope there. That microscope getting picture from inside, and it is coming to outside in the screen of a TV. This is called endoscopy. This is very important thing for present day medicine practice. And this is the 2 picture of endoscopic picture. Endoscopic picture of TB cecum. The endoscopic picture. See, this picture has come from inside. You cannot go there to see it. Your microscope is giving this picture. And microscope means that microscope that's at the point of time at the teeny end, and here a line comes in your computer. From computer you are getting the picture. Plumbum acetica for intestinal tuberculosis. That is, we have come to remedy portion. Intestinal TB with uncontrollable constipation, 3 extravasation thrice a day. Causticum for intestinal tuberculosis. Patient intensely sympathetic to others suffering, bite cheeks during chewing, can pass stool better when standing. Give 32 times a day for 2 days. Calibicrobicum for intestinal tuberculosis. Old diarrhea with chronic ulcers in intestine. Soreness in right hypochondrium. Right hypochondrium is this area. This is the abdomen. Abdomen has been divided into these 9 positions. This picture I have seen so many times. I have shown it, and I will show in future also. So this is right hypochondriac area. Tendo Achilles, Solen pendant. Tendo Achilles, this is the tendo Achilles. See, this is our calf muscles. The calf muscles forms a tendon to be inserted in the heel bone. So this strong rope-like structure is called tendo Achilles. There's a interesting story behind it. Achilles, Achilles is a hero of Greece, Greek hero. He was a very great hero, but at the time of war, he has been stuck with an arrow in his tendo Achilles, and he died out of that injury. So from that time, this tendon has been called tendo Achilles or Achilles tendon, both things. Chaparogo amargosa. Amargosa for intestinal tuberculosis, persistent old diarrhea continuing for months after months. No remedy proves efficacious. Give mother tincture 2 dram 8 hourly. ZII 2 dram. Mark core for intestinal tuberculosis. Ulcer in large intestine. Stool bloody, full of mucus, tremendous tenesmus. Frank blood dysentery. Give mark core 3 hourly. Hypersalve for intestinal tuberculosis. Abdomen distended, tense, middle lower lip cracked, chronic fetid diarrhea. Give 6, hypersalve 6, 4 times a day. Ars iodium for intestinal tuberculosis. Profound prostration, restlessness, recurrent fever, night sweats. Chronic watery diarrhea. Start with 4x trituration, 5 grain thrice a day, then go gradually lower up to 2x in the same way, that is 5 grain thrice. Dr. Boric has suggested this thing. Calcarea carbonica for intestinal tuberculosis. Inguinal and mesenteric gland swollen, painful. Cannot tolerate tight clothing around waist. Diarrhea with undigested foods. Fetid with ravenous appetite. Gives 6, 4 times a day. With this, the video ends. Thanks for listening, viewing. If you've got any problem, please write it in the comment section. I would certainly attend.